Good morning. My name is Nile Bayard, and today I will be presenting the disease tetanus. So today I'm going to tell you about the causes, history of tetanus first, then the causes, symptoms, treatments, the vaccine, its benefits and its side effects, and various statistics. First I'll move into the background. So tetanus was discovered in Kemet over 3,000 years ago. And Kemet is the proper name for ancient Egypt. And the illness was discovered in the United States of America in the 1940s. And booster shots were developed soon after its discovery. And the disease went on a steady decrease as the vaccine began to develop. I'll begin to move into causes, symptoms, and treatment. The cause of this disease is the Clostridium tetani bacteria, as shown here in this picture. It is an aerobic spore. And once the bacteria is released into your body, it releases a neurotoxin called tetanospasmin, and it causes tension and cramping in the muscles. And it is found in the intestines of certain animals, mainly domestic animals such as horses, chickens, and sometimes humans. The main way to contract this disease is through dirt, soil, manure, and through splinters. And usually what will happen if you have like an open cut or wound that hasn't been treated or covered, what will usually happen is the bacteria in the dirt will enter through the cut or wound. And most people think that if you get stabbed by a rusty nail, you automatically have tetanus. That's not true unless the rust on the nail is actually carrying the bacteria. Some symptoms of the disease include fever, muscle stiffness, spasms, and excessive drool. And these symptoms that are shown up top, these are the much more common symptoms and begin to happen about after a week after infection. And these symptoms last for about a week as well. And if you're not treated soon, then you'll begin to show a lot more severe symptoms, such as airway obstruction, respiratory arrest, heart failure, pneumonia, severe brain damage, heart attack, kidney failure, and septicemia. And what septicemia is, it's basically a version of sepsis, which is, the non-medical term is blood poisoning. A treatment for this disease. Treatment is for people who already have it in them, who already begin to show certain symptoms. So one may take various antibiotics, they may have to go on bed rest. There are various sedatives you can take. And this here is an image of the tetanus antitoxin. The vaccine was developed soon after the discovery of disease in around the 1950s. It is called the Tdap or DTaP vaccine, and it covers 3 other diseases: diphtheria, pertussis, and tetanus. And the process for vaccination begins sometime after infancy. So once you're born, you will be given a series of booster shots, and those booster shots will help. It doesn't work as well as the vaccine, so what it basically does, it just keeps you immune for a little bit. But once you reach age 7, before you go into the 3rd grade, it's mandatory that you have this vaccine, and you will receive 5 doses of the vaccine. Well, the vaccine lasts for 10 years, and it is very effective. Only 4 out of 100 million people died and were reported having the disease after receiving the vaccine. The vaccine does have a lot of side effects. These are the simple side effects. They include swelling in the shoulder, where you may have received the vaccine. In some cases, you may notice swelling in the shoulder in the opposite. You may notice swelling in the shoulder opposite of what you received the shot in. There's headaches, stuffy nose, and a lot of abdominal pain. Side effects tend to go away after a few weeks to a month. And these side effects are the most common of the side effects and tend to happen in about 95% of the cases. The vaccine also has many severe side effects, but these side effects are not very common. But if these side effects begin to show, you can develop a lot of other medical problems. These side effects include long-term coma, permanent brain damage, tiredness, long-term seizures, lower level of consciousness, nonstop crime, or appetite. And these tend to last longer, and you may have to go back into the hospital if you start to show any of these side effects. Now I'm going to talk about statistics in the United States and in the world. So by gender, in 2002 there was a survey, and 223 cases of tetanus were observed. 183 of those cases were found in men, and in other surveys it is shown that men are more likely to contract the disease than women. And then statistics on race, 76.8% of the cases in that same survey were found in Caucasians, and only 0.07% were found in African Americans, and 23.13% were found in Asians, Hispanics, and Native people. This here is an image of how tetanus is around the world. Because now today, since most countries, even third world countries like Africa and Asia, have the vaccine available, there are only certain countries in Africa, such as Sudan and Nigeria, that still lack the vaccine. But as you can see, around much of the world, the disease is not as popular as it once was. So due to this, there's not a lot of medical research on tetanus now, because the disease is slowly dying out. The CDC is actually talking about the possible eradication of tetanus due to how many countries and continents have the vaccine available to them. And in the United States, there are really any cases now. Now, my conclusion is that tetanus is still a very lethal disease. However, it can be prevented with vaccination and basic hygiene, and it is less common to the world now thanks to the Tdap vaccine. This is my list of references. I'd like to acknowledge my mother, Shayna, my father, Norman, my sisters, Nadia and Tendai, my brother, Will, my godparents, Joe and Jerry, Miss Crystal Lau, Dr. Charles Nib, Dr. Moses Williams, Mr. Robinson, my friends in the Creed, the almighty high power God. I now open the floor to questions and comments.
What's an aerobic spore?
An aerobic spore is basically like a bacteria that's carried through the air, but then will eventually, I know for this bacteria, it's carried through the air and will then eventually land in dirt or manure. Ms. Lau?
Why is tetanus more common in Caucasians than any other race?
I did not specifically cover that area of research, but I will get back to you. Tucson?
Are different forms of it Are different forms of it found in different animals on your treatment slide that shock equine origin?
No, there aren't really different forms of the disease. There's only one form, and it's basically the same throughout. It's the same bacteria found in all the animals. Ms. Lau?
What you mentioned that the WHO is thinking about coming up with some eradication procedures. Did you come across any research on what those procedures would be exactly?
Not exactly, because there's not a lot of research on it now, but the organizations are thinking about developing the vaccine more, in not the sense of that it's a vaccine and just prevents you for 10 years. They're thinking about having something, a legitimate cure, so that it will keep you immune for however long you're supposed to live. Ms. Lau?
So you said that the current tetanus vaccine lasts for 10 years. So does that mean that you have to keep getting booster shots every 10 years, or how does that work?
No, basically you should get it again once you're in college, and then it's important that you take the vaccine once you reach age 65, because that's when your immune system starts to decrease, or the quality of